still has had it with her spider veins. She had maintained her shapely legs through multiple decades and through birthing and raising 5 kids.
Just decided it was time.
Time for these to go.
I would like to show off my legs. I would like to wear some shorts, yes, in the summertime.
Getting ready.
Getting ready, yes.
She walked into the Vein and Vascular Institute with only one concern.
That they don't go away.
Or that there may be permanent discoloration, scarring from post-procedure bruising and marks that don't completely fade away.
It's almost as bad as just having the vein.
Exactly. And so we want to do things that can help minimize any of the complications associated with sclerotherapy.
Like hyperpigmentation or veins filling up again after they've been zapped and collapsed.
We not only want to treat the obvious veins that we see here, but we want to treat the feeding source.
A source invisible to the naked eye that may be lurking below some of these patches on top.
So when I use this lighting source, now I can see, and boom, there is the vein that's the underlying source for that whole complex of spider veins.
For that, vascular surgeon Charles Dietzek is adding a new and second procedure called segmental interruption. She's got to be numbed up for this part. And it's a good thing Michelle can't see what's coming.
This doesn't hurt.
No.
And the source vein was injected with a different concentration solution in order to deal with that larger vein. I'm just going to take this, and this is going to basically divide that vein. I'm basically cutting it off from the skin.
He says Michelle falls into a group that may benefit most from this procedure.
People that are from Asia, South America, olive skin, darker skin, African Americans, these are the individuals that are more likely to have a problem with hyperpigmentation.
Zapping and disrupting, all done, then a snug wrapping.
To help keep the veins collapsed. And the longer we can compress the vein, the better.
He recommends a few days, then compression stockings for at least a week.
I'm done with you.
You look a little bit like a mummy so far. What do you think?
I could be back and get some more, yes.
Still recovering, the doctor says Michelle's legs should be clear and smooth in another week or two. If not, Dr. Dietzek says she may need a follow-up treatment, but that's not likely. Weeks of recovery time is why he says you should really plan this kind of procedure way in advance. A 15-minute session of sclero and segmental interruption costs about $400. Joyce Evans, Fox 29 News.